Evening.
Very good evening. It gives me immense pleasure to be a part of this proud depressive movement founded by Archana Verma ma'am, 1995 batch IS officer and Principal Secretary Assam. This group consists of 50 members at present coming from various fields. This group, through its movement, has helped in has helped not only those who have dealt with mental health issues or are dealing with mental health issues, but have also helped in destigmatizing mental health through its generous efforts on social media as well as off social media. Today we have this 16th Proud Depressive session, Unwind Anxiety with a Beautiful Mindset, with Mrs. Sapna Yadav as our main speaker. At the end of the session, clinical psychologist and an active member of Proud Depressive, Ms. Suneha Naik, will address the questions that will be raised. Before we move ahead with the session, I would like to share a brief introduction of our speaker for the day today. Sabna Yadav, who currently resides in Sydney with her husband and two sons, completed her education in India, where she initially worked as a lecturer and later migrated to Australia. While in Australia, she left the corporate world to lend her time to being an early childhood educator and has worked very passionately in bringing about positive changes in the lives of special kids. She has even worked with old age homes and now intends to get into entrepreneurship. Wishing her all the luck and now requesting her to take on and share her story. We are on to you, Sabna Yadav ma'am. Um, Please unmute yourself, ma'am, if you. Yeah, you need to unmute yourself.
Yes.
Yes.
Okay. Thank you very much. First of all, I'm so happy to be a part of this group, and I thank Mimi for putting me in this group, and I would like to thank the founder members for forming this group where we can be ourselves, express ourselves freely, and create awareness about mental illness. So, the founder members, Ms. Archana and Lisa Patek. Thank you so much. Anxiety and depression, as we call it, I had this since childhood, but I did not know, what it is called. So awareness of this, that there is something going on in my mind, started very early in school. So I was born in Nagpur and I studied in Mumbai. So I went to Cardinal Gracious High School, and our school was very, very strict. So our father, the principal, used to stand with a cane, and we were caned regularly. So as a result of that, I used to cry every day to go to school. And my mom used to take a stick and run, run after me, and my brother used to try to save me. So she never understood why I was crying, and I never told her the real reason, because I used to think that school is supposed to be like that. One day my dad saw a bruise on my leg and he asked, what is the bruise? And I said that sir was hitting everybody. And he said, did you do anything? And I said, no, I did not do anything. So he wrote a letter. My dad was the Joint Commissioner of Food and Drug Administration, so he never had time actually to come to school and talk to the teachers. He gave me a letter, and so I went and gave the letter to the class teacher. The class teacher asked the PE sir, why did you hit her? And he said, I don't even remember when I hit her, because he was just hitting everybody. That was a norm at that time. That because there were so many children, they used to just cane everybody, hit everybody. So for me, I was about 6 years old, and for me that was a very scary place. And nobody was identifying, what was wrong with me. So every time I had to go to school, I used to feel something in my stomach, and I don't know how I used to face school every day. So this went on, and then up till standard 7. And then 7th standard, my dad got transferred to Dhulia, and I changed my school. And there were Italian sisters. An Italian sister, Sister Superior, she gave me a flower on the first day. And I felt so happy. It was a big contrast. I immersed myself in studies, and nothing showed up as yet. It was only during exams and stuff that I would feel a little anxious. Then I studied in Nagpur, and after that again we came back to Mumbai. So in Mumbai I felt anxious whenever I had to go alone anywhere and stand at the bus stop. I used to get a feeling that what if I forget who I am and I won't be able to come back home. But if I told this to anybody, they would start laughing. So somehow I used to gather the courage and go. So although I got admission in Nagpur Medical College, I decided to do home science because I did not want to stay in Nagpur, but I wanted to be with my parents. And so I thought, let me take the easy route. I don't want to take anything tough. So I had to take a bus and go, and then to the bus stop I used to go with my heart beating very fast, and all the while I used to be so anxious, get into the bus, get off. And every day I used to face this. When I went for holidays to my cousins in Nagpur, I used to talk to my mama, and I used to tell him that I'm getting these thoughts and they trouble me a lot. And he used to say that thoughts are like monkeys, you just let them come and go. You don't give attention to them. So by the time I graduated, this was becoming more and more. So for example, if I used to see any poor people, or if I heard somebody had died, I used to feel very, very sad, and I used to always have the question that why are we born? What is the purpose of life? And I have twin mamas as well, so I have 4 mamas altogether. One is no more. So one of my mamas used to say that you are becoming Gautam Buddha. Why are you so worried about, why we are born? Once when I was 7 years old and we had gone to Matheran, I asked my dad, why are you and why am I? So nobody was giving me any answers. And I used to be very confused about, I used to think how come nobody knows and how come they are all so happy, because these are all big questions that we are just living like this, and but my grandfather, like my nana, mommy's dad, he's very religious, and he used to take us to the church, and he taught us prayers, and so praying used to give me a lot of relief, and I used to pray every night and every morning because he had taught us to pray. So somehow I completed my graduation, BSc Home Science, and then I decided to do a postgraduate diploma in front office management and tourism. So this depression feeling would not be constant. It would come and go, come and go. Whenever there was something new to be done, it would come. So I did not have any way that I could cope with it. I had to just face it. That's it. And then once I had accomplished that, then I would feel a little better that, okay, I'm done with it. So once during my final exam, I became very anxious in BSc Home Science. So my mom had to come, and she was sitting outside, out in the college till I finished my exams. So in all the years, that was only one time that she had come. So when I went to catering college, my husband saw me, and he was doing 4th year and I was doing my postgraduate diploma. He actually had finished his course but taken up a job, but they introduced another year of management and he came back. So he saw me and somehow he fell in love and he thought, this girl I'm going to marry. Something came in his mind that this is the girl I want to marry. So he sent me an eclair card, but at that stage I was still worried about the world and what are we doing here. So I did not talk that much to him. So 1.5 years went by like that, and I didn't get to know him. I just went out once with him to have ice cream or something, and we didn't exchange any address or anything like that. So finally, he got a job in Bangalore, and he decided to take it. So before he went, he just left a note for me saying, "If you ever think of me, write to me at my hotel address." And he gave it to somebody, one of his friends, and said, "If you see Sapna, then you give it to her." So it was by chance that I went to return the books, and that girl was standing there and she gave it to me. So when I read that, I felt bad that, he was really wanting to know me and I never gave him a chance. So I started writing to him. And in the first letter, he said that he wants to get married to me. So I said that you don't even know me. I get so many thoughts and I worry about so many things, and you have to know me first. So he said, "Yeah, I don't care, what you can think as much as you want." But actually, I was so anxious that I will not be able to do the role of a wife and all the expectations that are there when you get married. You have to, be a daughter-in-law, and then there will be such big families, and I don't know what, in what way I have to behave and all that. But so we started writing to each other, and then he came to Mumbai, and then I thought, oh my God, through letters this is okay, but when he is actually in front of me, I don't know whether I'll feel comfortable. But when he came, he is a very calm person, and I really felt very comfortable. Like, he never put any pressure on me, and I used to feel very safe with him. So then I said yes, and then we got married. So I had imagined a very bad scenario, but nothing happened. And I got married, and I was happy, and we moved to Bangalore. And again, I had to start life where I had to go out alone on my own. And every time I had to go out, I would again feel that anxiety. So little by little, I used to go and do things, and then my husband used to say, "Yeah, you go to the bank, do this, do that," and I used to feel, "Oh my God, how will I do it?" But then slowly I would go and do it, and then I would feel very good about it. So this went on. And then I did a German language course, and I got busy with that, and then my 2 children were born, and then I got busy, and that time I never had any bad thoughts except for worry about the children. So then what happened was, in 1999, I was very attached to my father, and the reason is that for him, I never did anything wrong. So anything that I did, he was very protective about me. So my dad had a septal heart defect, and we found out only when he was 60, and he did not want to get operated. So when he was 63, he was in Mumbai, and he had gone to Nanavati hospital to see someone else. And while he was talking to this friend, he got a heart attack. And so my mother went and spoke to the doctor, and they took him, and he told all the medicines and everything that he was taking, and then they gave him some life-saving drug or something, and immediately he passed away. And I was in Hubli that time, me, my husband, and 2 kids. So I got a phone call saying that your father has had a massive heart attack, so you have to leave right now. So we took the bus, and then we went to Mumbai. It was raining heavily, and so we went, and we went to our apartment, and we kept the kids in our apartment, and we went to. My dad was born a Hindu, but my mom a Christian. But he had told my brother that my last rite should be according to Christianity. So we went directly where they were going to bury him. So we went there, and this was the first time that I was facing death. So I was I did not know I was in shock actually. So when we went there, they were singing hymns, and it was very beautiful. So my husband said, "You have to go and say bye." and everybody was very hesitant to let me go and see my dad, but my husband said, no, you have to say goodbye. So when I went there and I saw my dad was wearing a suit and he looked like an angel really, and then I went and kissed him on his forehead, and I felt that, he was very cold, and that's it. After 1 second my mama just pulled me and said, that's it. So I was thinking, give me just 1 more minute, to say my bye properly. So that happened, and then we went home. And I was crying, but I was still able to cope and still trying to absorb that information, because when I went home, I saw the place where dad used to, brush his teeth, or everything that I saw, his clothes that had come from the hospital. I opened the washing machine and I saw that the things that he was wearing had blood, and I was thinking, how come there is blood? So my brother came from US and he took everything to US, like he packed everything that was making us cry. So I was crying for about 1 month. All the time I was crying, and then after 1 month I kept praying that, I can't imagine this world without my father in it, and I don't feel like living at all. And I used to look at my children and think that I don't know how these children are going to grow, without me. I just didn't feel like getting up or even having a cup of tea, or everything became a big, like I never felt like doing anything. I just wanted to stop living, but I did not know how to do that. So my mother actually was talking one day to the doctor next door, and she said that I don't know what is wrong with her. She's just not responding to anything. So he said, oh, take her to a psychiatrist. So she said, you only take. So he took me to a psychiatrist, but the psychiatrist was not very friendly. He said, he spoke to me and he said, you have deep depression, so you take these medicines. And then I didn't feel like taking those medicines. So I just kept praying, and I was praying, and I said, Daddy, if you are somewhere, just show yourself once and then I will continue to live. So then I had a spiritual experience. So I was not expecting that anything will happen, but I was trying very hard to be normal. So what happened was that after about 2 months, I was walking, we had gone out, we came inside, and I opened the house, and as I was walking in, after removing my shoes, I saw my father's form sitting on his usual place, and he was wearing a lungi and kurta, and it was so quick. I saw him, and then within 1 second, it was like very transparent, within 1 second, disappeared. So I was so happy when I saw that, and it was so quick, but it registered that it was him. And I felt very happy, and I told everybody in the house, but I don't think that they believed me, because they thought that I'm just in shock, so nobody believed me. But my son's friend, he was at the time 10, he also told, he said, Arey, Nana udhar baithe hai. So he also saw. And I don't know why nobody was believing. They were thinking that I'm imagining it or hallucinating or something. So anyway, that happened, and then once what happened was that I was changing my younger son's nappy at night. I woke up, I was sitting like this, changing his nappy, and then suddenly one big jewel kind of light started shining on his t-shirt. And I said, I was waking up my husband and saying, Nikhil, see, what is this light, how it is shining and all, and he was fast asleep, and then that light disappeared. So I didn't know what is this, like, I had never heard about this. So then, by then, college holidays, I was a lecturer then, college holidays had started, and I could not teach anymore, because even to put any training session, I was not having the confidence to do that. So one of my ex-students came, and normally I was not wanting to talk to anybody, but that day I came. out and spoke to her. So she said, "Ma'am, I will take you to a very good psychiatrist." So she took me to one Dr. Vaijayanti in Hubli. And when I went to Dr. Vaijayanti, I just cried and cried. And she said, "You don't worry, I know what you have, and it's called as depression, and you will get better. You will get better in 15 days, you will start feeling better." And I felt so happy that, this thing that I'm suffering has got a name and I'm not making it up. So she gave me some medicine, and then she also gave me a book because I was asking her whether I'll find my dad again and all those things. So Many Masters, Many Lives by Dr. Brian Weiss. She gave me that book and she said, "You will find all your answers here." So she gave me her own copy. When I went home and I read the book, it had everything that I'd gone through. It spoke about those lights. It spoke about, what happens after death and whether people who die can come and show themselves. So everything that I had experienced, it was not something that I had imagined. After taking the medicine, after about 20 days, I felt such a big difference. It was like for the first time, I could see everything clearly. It is like a person who has got glasses and has never worn glasses. If you give him a pair of glasses and he can see, the blackboard clearly, it became like that. So if somebody had identified this in childhood and taken me to a psychiatrist, I used to tell them, "Take me to a psychiatrist," but somehow nobody used to take me. I don't know why, because I myself wanted to get better and I knew that these thoughts are troubling me. But I think that people did not want to hear that word psychiatrist, so nobody took me. So I felt so good after that, like I could function, I could think properly, and my decision making became better, and I joined aerobics and I was able to not be sad anymore, and I started slowly living, looking after my kids and leading a normal life. So I took the medicine for about 9 months, and then after that we migrated to New Zealand. So I had stopped taking the medicines completely. When we went to New Zealand, everything was new, and we had to start again, like leave our jobs, everything, new country, and start again from the bottom. So my first job was in an old age home, and because I got better, I was ready to take any challenge for my kids, because I thought that they should get a very good opportunity to study there, because I was very disappointed with the education system that we have in Hubli, because there was a lot of corruption, the books were not corrected, and I was very, very disheartened by the way that they were behaving. So when I went to New Zealand, it was a very pleasant change, and I really liked it very much. So for jobs, we just took anything that came our way. So my job was in an old age home. That was the only job that I could get. And my husband encouraged me and said, "Just think of it as a divine thing that you're doing." So I felt happy actually, because I used to see those old people, all their lives things, just the pictures of their children they used to bring in that small room, and sometimes nobody used to come and meet them. So I did that job, and then I decided to do nursing, and so I joined a course in nursing. And when I was in the first year of nursing, I studied very hard for it. So I had to learn driving. So we had only one car, so I had to drop my husband, then come back, then drop my children, attend college, and then after coming back, I had to, while coming back, pick up everybody, then do all the housework and then study. But I was able to do everything. And then I didn't know there was any award, but I got the Southland Hospital Award for first year, and I was so happy, because I did not even know that there was an award for year one student. And after first year, my husband, he got a job in another city, Queenstown. It's a very beautiful place. So then that means I had to leave nursing, because Queenstown did not have the school of nursing. So in second year, I left nursing, and I took up a job as a medical receptionist, and we moved again to Queenstown. But before we moved, what happened was, so by now I was not taking any medicines, but so this place is called as Invercargill. My in-laws decided to come. So my in-laws, I was very happy that they are coming. My mother-in-law, my father-in-law, and brother-in-law. So we were in South Island. I was with my sons, and my husband went to North Island to receive them and to show them. So I was preparing everything, and just as their plane was landing, I don't know what happened. My hands started sweating, and I started getting those same thoughts. I don't know, like the thoughts that I used to get could be anything random. It could be like what is time or something like that, something very random. So I was really feeling very, very shaky, but I somehow took the car, I got them. But every day to behave normally was becoming very, very difficult, and they never put any pressure on me. It was me putting pressure on myself, because I was thinking that I should do everything perfectly. But they were not doing anything. Like, they in fact used to say that you take rest and everything. When I could not bear it anymore, I told my husband that I need to see a doctor, and you tell Mummy ji, Papa ji what is wrong with me. So he took me to the doctor, and then again they started me on another medicine, citalopram. So when I came back from the doctor, I told Mummy ji, Papa ji that he said that she's having depression. And my mother-in-law is so good, like she said, yeah, it's okay, everybody has got some problem or the other. I forgot to mention that when my mother-in-law had come before we got married, I had told her also that I get these thoughts, but she never said anything. She said, it's okay, no problem. Like, I really admire her for that, because I had told her about this, but even then she agreed to the marriage. So since then, I decided that I would never be without the medicines. And since then, I have always taken the medicines. And whatever, I have noticed that whenever there is any change in any situation, like a new job, or even if we go on a holiday, any change is when I get that anxiety. And so my doctor, I used to go to a doctor there in Queenstown, and I used to say that this is a holiday, but why am I feeling so anxious? It's only going to be our family. And she used to say, don't worry, in family also people, like, they fight a lot. She used to joke about it. So I have always monitored my medicine and always had it reviewed. So for the last, I think, nearly 17-18 years, I am taking antidepressant medicines. Many people say that, oh, you become dependent on it and all, but I don't feel that, because without that, without taking the medicine, I know how bad I feel, and I never want to feel like that again. But I always make sure that I see the psychiatrist and whether the medicine is working or not. And I have always taken counseling, because whenever any life situation has come for which I have not been prepared, like my mother was very, very ill in 2018, and I had to go to India about 4 or 5 times to sort out her issues. So I have taken counseling, and luckily the counselor that I got is Indian, and he also is very spiritual. So all my questions about life and everything he answers. So I've been very, very lucky to have him even in Sydney. So there is this mechanism that I have found that helps me to deal with anxiety. So one is I do the meditation by Dr. Brian Weiss. I do that, and I do the gratitude diary. I do that, and I keep reading a lot of books. Plus, I also love to watch the NDE experiences, near-death experiences, because whatever near-death experiences I have seen, everything is so beautiful. So I think that in my mind, you always think that something bad is going to happen, but something very beautiful happens. Like, I had never imagined that we are going to live in a beautiful place like Queenstown. At the most, I used to think that my children will study in Ooty. But when we came to Queenstown, I thought, my God, this is so beautiful. So I think that we always, visualize the worst scenarios, but it's not like that. Whatever our mind says to us does not come true, and they are not our thoughts. They are sometimes negative thoughts, but they are not ours. They are just like floating, and you just think that they are yours, but they are not yours. So we should not get disturbed by them. So, is there anything I have missed? I'm just looking at my coping mechanisms of what else. Oh yeah, I enjoy dancing. So when I was in New Zealand, there was a group called Multi Nations. So I had joined that, and in that group, every month we used to meet all the new migrants, and we used to perform. I used to teach them some Bollywood dancing, and whenever I was dancing or listening to music, I used to forget about everything. And I think whenever there is a challenge of any kind, I feel very happy. But when life becomes monotonous, then I think that, oh, what is the meaning of this? But working with, I did not know what job is good for me. So I have taken up different jobs. But I have really felt very happy working with children, and especially with children with autism or people who are vulnerable, and I could really connect with them because I think I understood what they are going through. When they are rejected, I could understand that, and I work with children only because I know the pain that I've gone through as a child where nobody could understand me. But also I want to say that God has been so kind to me. When I was growing up, I had a neighbor, and her name was Shobha Mhatre, and she did not have children for 12 years. They were newly married. So when my mother was pregnant, she became my mother's friend, and she looked after my mother. And then when I was born, she used to take me to her house and look after me. And I started calling her Ai, which in Marathi is mother, Ai and Baba. So I literally grew up in their house. And then after 3 years, she had her first child, and then later on she had two more. So our relationship is still remains. I is no more, Baba is no more, but the three children I am always in touch with. But I also helped me by loving me so much in my childhood. So my mother was not very expressive in the sense that she was not used to cuddling and things like that. But I used to do a lot of that and express. And she used to know she just cared so much for me. She was really longing for a child, and I really wanted to be loved. So she did that, and then when her children were born, she made sure that I never felt left out. She always used to say that she is our first daughter. She's always gave me a lot of importance. And when my son was born, she came to Bangalore. So she's like, I feel like I have two mothers. So that bond was so strong. It was not like a neighbor. It was like some soul connection we had. So anytime that there is any issue, I think God always, I'm so spiritual, so God always sends, somebody to help. And another thing is that in New Zealand, I made a friend, and our friendship still remains. So, having a good friend, talking to them, that is another way of coping with all the stresses. Yeah. That's it.
Thank you, thank you. Nobody has asked any questions. Would anybody like to ask something? Or would our clinical psychologist Suneha try to come up with her observations? Any questions?
Yeah,
No questions here?
Yes.
Yeah, no questions as yet.
I'd like to ask Latika here. Yeah.
Yes.
I wanted to know. Yes, I wanted to know whether taking antidepressants is okay in the long run. I want to understand that because I had a trigger also myself in 2019 when my daughter was in Canada, and she was undergoing difficult times, and I handheld her, and I went into, she emerged, but I went into a depression, and anxiety, etc. And I consulted a psychiatrist. Within, I could identify what is wrong with me. I went straight away to the psychiatrist, and I was put on medicines, and I took them for almost a year and a half, and I just felt better and better. And the medicines were tapered off, and then suddenly, and I was good until I had COVID in April, but I emerged very nicely, at home recovery, etc. But then on August 22nd this year, again, I went into suddenly a dark feeling and, a sadness, which I could not identify where it came from, and it came. And what's happened is now I'm trying to battle, the feelings by just taking homeopathy for the last 2 months, and but there are days when I'm okay. I do a lot of meditation, yoga, a lot of meditation and pranayam. I start playing tennis, and I am 63, so even at this age, I'm able to do that. And I mean, it's not my life is per se, there's nothing wrong with it, but I really don't understand where this comes from. And according to psychiatrists, it's basically, could be any multifarious reasons. I mean, your hormones, your genetics, your, etc., etc., etc. So sometimes I feel, okay, what is the use of, I think somewhere I've not been able to let go of my daughter, the only child, the only daughter who went. And I mean, sometimes when one is in anxiety and depression, one doesn't know what is the exact root cause. Okay, so I wanted to here understand, and I'm battling with it. So I'm just wondering, is taking antidepressants in the long term, and at my age at 63, is it okay if I start taking it? I have the prescription ready anytime, and I've shared this with my psychiatrist, and he said, try homeopathy. If you feel you're not able to cope with it, go ahead with antidepressants. And we Google a lot, and I read that, that it really doesn't have, you can take it long term, etc. So I needed this to be answered by the psychiatrist here.
Yeah, so I think the psychiatrist that you have been seeing till now would be better able to answer the neurological part of it, neurochemical aspects of it. But psychologically, from a psychological point of view, I would say that each body is very, very unique. So whatever you have been going through at different phases, that is why the dose is either increased or it is lessened based on the symptoms and how you're coping up with things. So wherever these new stressors are concerned, wherever there are thoughts concerned, then we go ahead with behavioral changes. So as much as medications are important, so these getting to know about your beliefs and making some modifications in your daily life, that is also very, very important along with that. So the relapse rate would be lower if you do both the things simultaneously. So in depth, if you want to know, I think we will have to talk separately on a different call to understand this better.
Latika, can I? I'm Archana Verma. Okay, I would like to just respond. Although I'm no doctor, the thing is that what my psychiatrist tells me, that the brain is like any other organ in the body. It is just another organ which, like your liver, like your stomach, which is subject to tear and wear. So the problem with this whole thing is, and that's why I started this movement, was that the problem with us is, and even now I have the same problems which you have, that the problem with us is that we refuse to recognize that brain is part of the body. If any, like I am deficient in serotonin. I mean, however much yoga I do, however much running I do, that serotonin never will reach that level It's like in diabetes, if you need insulin and if you go on doing yoga, you will not get the insulin from your yoga meditation playing, because then you will have to take that insulin injection. So it's similar with the brain, that you have to. And I can tell you that it's not that if you take it, you will be fine all the time. There is no like, you will go through your lows, like Sapna has so honestly and so sincerely described. Like, I am presently going through a low that's why I've been out of circulation. And it is only with medicine that I have been able to come and face you all again. Because, and you see, I am 52, so I think that even if suppose, though the present day medication, my psychiatrist, and you have to have a good psychiatrist, says that, they don't have so much side effects. But even if they had, your quality of life is much more important than, longevity, like living 80 years. That's so, this whole movement is about, please seek proper professional help, and don't think that your brain is not is something which is spiritual and it is not part of your body. Like Sapna also initially, had all these existential issues like, who am I, what am I also keep having those existential issues, that life is not worth living. And then I go through all these phases, and people who know me very clearly see my phases, when, I go from high to low, almost like bipolar like. Lekin, फिर भी one has to go on living, because not living is not an option. So I feel that please don't hesitate, but your psychiatrist must be good. So please take medication. There is no issue, because you will go on taking homeopathy, you will go on taking everything, but I feel that you will not reach that level of the lack of chemical in your body. There are 4 chemicals which, brain, which are called the happiness chemicals. I hope you know. They are dopamine, serotonin, and oxytocin, and one more, I forget the name.
Endorphins.
Endorphins. So to have,
But still,
but I'm very honest. Yes, like
definitely. Sapna ji, you are so spiritual. Was there any activity or thought that helped you find peace or calm during an anxiety episode?
Yeah, that I always think that you think that you're alone, but you're never alone. I always tell myself that I'm always protected. Even in the worst times, like I used to think when my older son was born and the doctor was not coming, and I was shouting that, I didn't want to live. I was saying, kill me, kill me. Even then I was protected, because last minute the doctor came and saved us. So it is just that your brain is imagining so many things. So I think prayer helps me a lot. So nowadays when I pray, I ask them, I say, all my angels and my guides and my loved ones, please help me in this situation. Because I have heard that you have to ask for help. And only when we give them permission, then they can interfere in our life or help us. So that's why I have started saying that. And then when I say that, I think I get all the help. And my mother has also, like, when I was growing up, my dad, mom and me, we used to pray the Lord's Prayer before we went for work, and that has been a practice. So in my house, nobody prays, but I pray by myself, So it's just like faith. Yeah.
Okay, so can I pitch in here? So what I do is, I do breath work. So you just sit and you just follow your breath.
Yeah.
and you completely immerse yourself in your breath. Just watch it come in and go out. And in 5 minutes, 5 minutes, I feel calm. Okay, so
Yeah.
that's the way I handle it. Yes.
Can I make an observation here? Responding to Sapnaji's comments on prayers, I'm reminded of a conversation I had with my father, with both my parents, my mother and my father. My father was an atheist all his life and a Marxist by profession. And my mother comes from a very pious background, Hindu pious background, but she became an atheist over time with living with my father. So towards the end of my father's life, we were having this discussion about afterlife, and I always like talking about afterlife. So,
Me too.
my mother, as usual, the convert that she was by this time to atheism, said that there obviously cannot be anything on the other side, that we come to an end once we die. So it was at this point that my father, who was known to be an atheist and a Marxist, uh, not looking out up from his book, he used to hide his face inside his book, said, every religion says that there is afterlife. Every religious book admits that there is afterlife. So that was all that he said about God or death or afterlife. He didn't say anything more. I remember when I was about 11 or 12 years old, I think I asked him about God, and he then, while writing one of his articles, sitting at his dining table, he refused to use a study. He said, I don't talk about things I don't know. That was all. So this was nearly 45 years, 40 years later. He said every religion says that there is afterlife. I think that is very instructive. As we come to the end of our lives,
Yeah.
we realize that there is obviously something on the other side. As his dentist, Dr. Ranjan Majumdar, said after he died, he said he must have realized by this time that there might be something on the other side. So please don't start believing that you're wrong. You're probably completely correct when you say that probably your father is there on the other side and is with you
Oh,
wherever you are.
that's nice. Thank you.
Uh, would Suneha try to give her own
Yeah,
opinion about all this?
Yeah.
Yes?
yeah,
Yes.
I need to share my screen. Just give me a
Yes.
moment.
Yes, please.
Yeah. Is it visible?
Yeah, it's coming
Yes.
now.
Yes.
Yeah. All right. Because we all have experiences and we perceive things in a audio visual format. So I wanted this chart to be in front of you guys. So basically, this is the cognitive behavioral model of depression. So what happens? Everything starts from childhood. When we are a child, our personality starts developing. We develop morals, ethics, values, and our childhood experiences form the basis of our own belief system, which then forms over the years. Then we what we also call as the core beliefs, right? So we carry these core beliefs with us whenever we grow up, we face up with different situations. So whenever we face a different event, a critical incident that happens in our life, our that core belief gets activated at that time, and then we have these automatic thoughts, and especially in case of depression, the automatic thoughts are negative in content. So at that time, we have all these 5 different kinds of symptoms. Number one is somatic. So whenever we have somatic symptoms, our muscles tense up and we feel some kind of uneasiness in the body. There is some pain, and then we have behavioral symptoms. So basically, when we face behavioral symptoms, so we stop doing any kind of action, whatever we used to do previously. So we do not take any action. Then we have motivational symptoms. We lose the drive to do something. So that is there. Then affective symptoms, we feel lonely, there is intense sadness, and a lot of emotional high and lows. And then we have cognitive symptoms. So, sometimes our judgments gets very foggy and cloudy, and we are not able to focus on whatever we are doing. So these are the symptoms that we develop. So, for example, in Sapna's case also, she was very, very introverted when as a child, and that is a personality trait, right? So, most of us, we think that the child is very shy at that time, and we say, ki, no, no, you should go out and socialize. Why are you not doing this? And in her mom's case, she was a complete extrovert. So, there were clashes. So, and a lot of critical comments, not taking up responsibilities at that time because she was very overprotected. And the reason was, and also she was very, very attached to her father because she found that acceptance from her father. And that is the reason when she lost her father, then, it suddenly triggered something in her. And at that time, she was diagnosed with severe depression at that time. But and she was very lucky to have a very supportive husband, mother-in-law, and everybody who accepted her the way she is. So eventually she got that space to open up and face new challenges, different situations, which earlier it was very difficult for her to do. And spirituality really helped her cope up with things. So as per researchers also, there is this term called as spiritual intelligence, which is equally something which is very, very important as we have IQ and emotional intelligence, EQ, right? So IQ governs the left hand side of the brain, whereas the EQ covers the right hand side of the brain. And SQ is something which develops with spiritual practices, and even Latika mentioned breath work, mindfulness meditations. So these develop your SQ, and that governs your IQ and EQ both. It unifies your left and right hand side of the brain. So that is something which really helps you cope up with difficult situations. You have that faith, that hope that everything will happen, someday it will, be fine. And the experiences that Sapna shared about, having spiritual experiences. So, of course, it's very mystical, so everybody has different explanations about it. But whatever, you got to have these critical comments from relatives also that you might be hallucinating. So the critical difference here between spiritual experiences and hallucinations are the amount of experiences, whether is it related to positive experiences or is it related to distress and harmful, and is it harmful to yourself and others. So that is the distinction point between these two. So anything which leads to your self-development, transformation, enlightenment and growth, that is related to spiritual experiences, and it really helps with coping. So yeah, that was from my side about all these things. And I would also like to conclude with how to develop a positive mindset. We already discussed about these things, because whenever we are depressed, we tend to focus more on the negative things that are happening around. So like even Archana mentioned that packing also seems like a great task to do. So we should acknowledge the small things that we are able to do. Even if you're able to get up in the morning and fold your bed sheet, you need to appreciate that you're able to do something. So focus on the positive aspects. Then secondly, set clear, concise and achievable goals. So because baby step works, because nobody can jump from first step to 100th floor in just one day. So set very small goals and work towards it. Thirdly, maintaining a gratitude journal. It might be difficult for different people, but just practicing gratitude, because we don't know unless we are having a headache or stomach ache that our body is still there and it is working for us. So just being grateful for that one thing, that we are able to breathe, our body is functioning properly. So being grateful about it. So that can also help you develop a positive mindset. Then fourthly, being interconnected is very, very important. So check in with your loved ones, have a positive social circle, and share whatever it is there in you. And lastly, use positive statements and affirmations. So that's all from my side. Thank you so much for listening and joining in.
Thank you so much. Thank you so much. Suneha, there's one more thing that I would want to ask you, since we are speaking about, childhood experiences and how they affect your adulthood. To what extent do these childhood experiences manifest into some kind of an illness in the adulthood? To what extent, one. And second thing is whether they can be identified during childhood itself and, tackled at the same time. Yeah, so that the adulthood remains free of any mental burden. Yes.
As we see, most of the mental illness which happens, that starts from adolescence. That is the starting point, because childhood is really very, very important, and these experiences at the same time, if we are having the protective factors like very supportive family environment, that acceptance, then you develop these coping skills. As long you can definitely face a lot of stressors eventually in life and uncertainties, and we cannot escape that anyhow. But developing that coping mechanism is very, very important, which happens in the childhood, and eventually as we experience different things, we learn from those things. So having that growth mindset and open mind is very, very important at that time. And as you mentioned, there are certain personality traits, right? So there are one or two personality traits which are very, very important, which plays a very important role here, is neuroticism, which means sensitivity to negative experiences mostly. So people who are high on neuroticism factor, they are more prone to anxiety and depression. So that is one thing. And also genetic loading, it that is something which can maybe bolster the severity of the illness that you develop. Yeah, so
Suneha, can I also come in here?
yeah.
I also feel, because I feel that it also depends on the kind of mental illness you have.
Yes.
Depression, I feel, is lack of chemical,
That is
positive
definitely
lack
right.
of chemical. But if you have, say, like borderline personality disorder, their cognitive behavioral therapy, that CBT, really helps, because all the things that you're saying would also be more effective in other kinds of like in schizophrenia. If you just go for CBT and not for medication,
No.
then it won't help. Even for depression, I think.
Yeah. So as you
We
mentioned, schizophrenia and severe depression that we are talking about, they need to be first managed, because there is neurochemical imbalance, and they need to be first managed. And once they are in that managed state, then they can come for therapy, and they can do that sustainable changes which is required to sustain that lifestyle and maintain a proper so that there is no relapse. So it both works simultaneously. But even the research suggests that CBT is the first line of treatment for mild to moderate depression and anxiety. So it also depends from people to people. Some people are resistant to medication. Some are resistant to CBT. So that is where this eclectic approach which works. Mindfulness comes into the picture at that time. And any personality disorders, if I talk about, it's difficult to tackle them because it's a long term thing. But if you say there is an episode of depression, it still has a good prognosis to treatment.
But you were outstanding. That presentation was really good because
Thank you.
you have
Yes,
been able
absolutely.
to.
Thank you so
Absolutely.
much. And yes, I would also mention that medications are very, very important to have that balance, balancing those neurotransmitters. And apart from that, if you're using a holistic approach, you are doing mindfulness, meditations, yoga, exercise, fitness, then that can further release those happy hormones that is there. And it
Yes,
just
Suneha. Yeah, yeah. Yeah, in fact, that is what helped me the first time around.
yeah.
Yes.
So it's a vicious cycle. I mean, wherever it starts, even if it starts with emotions or triggers, then your neurotransmitters will be affected definitely because your mind and body are connected. You cannot just separate both of them, from each other.
Completely, like my starts with the gut. That's where
Yeah.
serotonin is produced. And
Yes.
now for the last 3, 4 months, my gut is not stabilizing. And medication is in fact exacerbating it. So,
Yeah. It makes you functional.
reveal or keep it private because
Definitely.
once you open out, then क्या होता है कि then there are people who are out there. I could feel the difference in the eyes because it's on Facebook. Everybody knows my driver's attitude. I could see changing towards me. My PA's attitude. Everybody became my counselor. कि अरे भाई सबको दुनिया को सबको दर्द है आपको क्या है मैडम. So or even friends कि they I felt sometimes कि बहुत pleasure मिलता है उनको to say कि okay, life is a package deal, so you can't get the best of everything. तो या नहीं भी मिलता है तो everybody तो I don't know. उस समय I was really thinking that maybe I should not have started. But then I guess this is what we have to fight.
Yes,
One has to
exactly.
even fight with self to
Yeah.
come out, despite the fact that coming out is not easy. It's difficult, and that one has been able to do only with medication. I am all for medication, even if it means whatever side effect it has, because
Yeah.
I feel anyway anything has side effects.
I don't think you've gone wrong anyway, but it's
Yeah.
just because that you started something like this, everyone started coming up and opening up to their own stories and sharing and even learning from each other. That's
Even
been a
I
plus
would
point.
like to say that we are people with rich emotional experiences, not people having emotional problems. That is something we can, frame it. And
Suneha, I
yeah,
just want to say you are so young, but you talk like a very wise woman, and that was fantastic. Thanks. That was
thank you so
absolutely
much.
fantastic. Thanks. Yeah.
So then,
Okay.
I have a question for
Yes,
you.
Anita.
Actually, I always feel that like something negative is going to happen. I don't feel positivity in my life. Anything, if I imagine a person, I always think negative about that. I get a negative vibe that he will leave or not, whether he will be okay or she will be okay, and I always feel that whether I will pass this exam or I will even crossing the road, I think the whether the car would hit me or can I pass the road confidently. I don't know why it happens with me. And even I went to a psychiatrist and she gave me medications, and she gave me Zolam and all. I took medications, but my mom, she doesn't like taking those medications. She scolded me, don't take those. You are not a mad person. Why you are taking medications? These are taken by mad persons. You are not mad, like that. She is scolding me. I told her that whenever I take the medications, like now Archana ma'am has said that when her medications were titrated, she got back that problem, that severity of the person. So even in my case also, whenever I stop the medication, I feel too low, and those feelings, those negative vibes again comes back. But whenever I take the medicines, I feel fine. So ma'am, it has been a very much problem to me. It's actually hampering my career also.
Yeah, so basically, never stop the medications abruptly because that can actually really have side effects. So, whenever if you want to stop, eventually do talk to your psychiatrist, and based on the dosage, he will decide whether it could be stopped or not. And definitely, whatever you were explaining, that I feel like this and all of that, that could be because of anxiety. And it's okay because it all happens based on your past experiences that you have had, and we learn from them, and sometimes those imprints stay forever, and it's difficult to face them and surpass them, but that's how life is. And eventually and slowly, when we work towards it, definitely we can work better in that way.
Thank
So
you.
Anandita, I would like to talk to you after this session,
Thank
and
you.
we can discuss
Sure, sure. Thank you.
in details better.
Thank you.
Yeah.
Hi, Smita.
Oh,
Hello.
hello. Hello, hello. Yes, I'm so sorry.
Am I audible?
Yes,
Okay.
yes.
So today it's a landmark day for all of us. First, it is because today is the last session of this year, 2021.
Yes.
Second is because today we have a very brand new moderator in our proud depressive club, that is Smita Salunke. Let's, give her a big round of applause
Please,
from all
please.
of us. She has been
Great.
wonderful. Okay, and
Thank you.
and the greatest achievement is this, that we have got back our Archana amidst
Yes.
us.
Yes,
So
yes.
before we say goodbye to each other, let's hope that 2022 will be the best ever year to remember. So from all of us, thank you so much for joining us. And let's look forward to more sessions we will discuss about it. And today we have a request from someone. I think you will pass me the number, Smita, as soon as this session is over. Thank you.
Yes, yes.
Thank you so much. Lovely session.
Mhm.
Glad to be a part of it. Yes.
Yes.
Thank you.
Yes.
Merry Christmas and Happy New Year
Merry
to
Christmas and Happy
everyone.
New
Thank you.
Year.
All the best to everyone. Thank you.
Bye
All right.
bye.